So when it comes to the underlying circuitry and what is going on, what is a brain of someone who has Tourette's doing as far as we know versus a typical brain?
Yeah. So the thinking is that in the basal ganglia, that is where the function of it is to select the movements that you want and to not do the movements that you don't want so that you can, you know, walk across the room. You have to have your basal ganglia saying, okay, I'm not going to have these other movements that keep you from being able to walk forward, for example. In somebody with tics, it's thought that there's some issue there, either in the basal ganglia or the signals that go in it or out of it, that are making it so these extra movements come out, these extra unwanted movements. That kind of contrasts to things like Parkinson's disease or Parkinsonism, where you're not getting the volitional movements that you want, right? A decreased amount of movement. So those are kind of two ends of the spectrum in that way.
Interesting. And being on two ends of the spectrum, have there been any insights from other unrelated neurological diseases that have contributed or given us any insights into things like Tourette's?
The biggest thing I would say is the dopamine aspect of it. So Haldol, like I was mentioning before, haloperidol is a dopamine blocker. So it blocks the dopamine receptors. And things like Parkinson's disease, they need more dopamine. They don't have enough dopamine, or the dopamine responses aren't strong enough. And so you give them dopamine. Whereas things like tics and Tourette syndrome, you might try to block the dopamine from causing that extra movement. So that's why things like haloperidol can be helpful, but also other kind of agents that address dopamine in different ways can be helpful.
So I'm wondering what the general age of onset for Tourette's or even movement disorders in general is there a trend? Because I'm thinking about, kids going through puberty, kind of coming out, people at different life stages.
Mm-hmm.
What have you seen?
So for the movement disorders in general, it's hard because they can be all so different and different causes. So we don't necessarily place it with a specific age at onset because the causes are so different. But something like tic disorders or Tourette syndrome, usually we see it in school-age children to start. So like between 4 and 8 years old is the most common time that they will start. Probably some of that's developmental. So a lot of kids will have tics at some point in their life that generally go away and don't cause a problem. And so that's why we don't diagnose Tourette syndrome or other kinds of persistent tic disorders until tics have been present for at least a year.
So let's talk a little bit about neurodegenerative diseases, the more rare ones. Tell me about how your work focuses on that.
So there are a number of different types of neurodegenerative diseases, and there are a number of types of neurodegenerative diseases of childhood. But my specific area of focus and passion is in something called the neuronal ceroid lipofuscinoses, NCLs, also called batten diseases. So lots of different names that we can use for it. These are a collection of different genetic diseases. So there are 13 different ones that have been identified, 13 different genes that all seem to start, for the most part, in childhood at different ages of onset, and can cause some core symptoms that they all have in common. So generally, there's going to be epilepsy at some point, cognitive decline, so they end up manifesting with a form of dementia, movement disorders, which is how my role kind of plays into that somewhat. Vision loss, so they lose their vision over time. And then there can also be some behavioral issues that come up, like mood problems or different kinds of behavioral dysregulations.
So these are hereditary diseases or are these random mutations?
They are generally inherited. So the majority of them, except for one form, are what we call autosomal recessive. So generally, you get one mutation or mutated gene from the mother and one mutated gene from the father, although sometimes there could be a de novo random one that comes up. But for the most part, they are inherited, that we find. And so they will, you will sometimes see several children in a family with a diagnosis because of that. So there's a 25% chance, right, that you would have another child that has that disease. And so sometimes we'll see that bear out.